Good evening, all. I'm Aditi Lamba coming to you from a remote location in New York City. Welcome to the Tuesday night South Asian news segment, Vision of Asia. We are bringing to you perspective and measures on the coronavirus pandemic. Today, the world count of COVID-19 cases topped 4.8 million with at least 319,000 deaths. In the United States, it is 1.5 million cases and more than 90,000 deaths. By the Memorial Day weekend, every U.S. state will begin lifting measures where many governors have pushed into the second phase of restarting their economies. New York, where we are coming from, will see some areas reopen starting tomorrow. New York Governor Andrew Cuomo said that the state would allow gathering up to 10 people for ceremonies during the Memorial Day weekend in certain areas, but again urged all to stay inside and continue practicing social distancing. Also, if you're on the front line or a nonprofit giving back to the community during this crisis, reach out to us on events@itvgold.com with your story and your experience. Tonight, we feature exclusive comments from acting Queensborough President Sharon, along with much on the needed efforts of testing availability, as well as a take on Indo-US trade investments during COVID-19. Here are the headlines. Acting Queensborough President Sharon addresses the Asian American community, Queens, New York. CII and US IBC host virtual event, India-US trade investment post-COVID-19 scenario. Indian Business Association and Accurate Diagnostics open COVID-19 drive-through testing site in Edison, New Jersey. It's time for a short break on Vision of Asia. Voice of the Community will be back shortly. Welcome back. I'm Aditi Lamba. This is Vision of Asia, special report on coronavirus impact, measures, and update. Today, New York Governor Cuomo said that 106 people died of COVID-19 statewide on Sunday, saying that it was the lowest number since March. He also stated that the state has more testing and to get a test if you have symptoms. This is surely good news, but what is the condition of the epicenter, New York City, and the ramifications of this ongoing economic and healthcare crisis while parts of the state begin to reopen? We recently spoke with acting Queensborough President Sharon on the impact of COVID-19 on hard-hit areas of Queens and her message for Asian American and immigrant communities that are in the heart of this crisis. She spoke to us on food insecurity, racial disparity, and resources available through the borough's office, while also urging all to participate in 2020 census and to exercise their very important right to vote.
The virus itself may not discriminate, right? It hits people of all ages, evidently now, not just older, but also children and babies. It reaches people of all, races, ethnicities, regardless of where it hits everybody. And while the virus itself may not discriminate, what the pandemic has done is it has exposed and it has amplified a lot of the inequities and the deficiencies in access to care and resources and safety. And so when we talk about how hard certain areas of the nation, certain areas of New York, certain areas of our borough have been hit, it's not because the virus they're necessarily more susceptible to the virus. It's really a product or the result of already existing inequities and deficiencies. We talk about underlying conditions. It has exposed some of the underlying conditions in terms of services and access. So we've been working around the clock, and everywhere around the borough, you are seeing some of the worst, right? We've got some unscrupulous folks trying to capitalize on life and death, trying to take advantage of people at their most vulnerable, consumer fraud. And these are things that law enforcement and leaders are keeping a close eye on and trying to make sure that in partnership with folks like ITV to get the truth out there that no, there's not one pill that can, solve it can cure you, or you don't have to pay for a COVID test, right? So what's truth and what's not truth, that I think is something that is critically needed. But what the pandemic has also amplified is some of the best. We've seen people really step up, people being so selfless, putting themselves and their lives on the line to help people, moving mountains with whatever resources are available. And also, it's reminded us what is essential, right? When we talk about who is essential in our society, and yes, it's the frontline workers, like the hospital workers and firefighters and EMS and our police officers. It's also the grocery store clerks, the ones who are stocking the shelves, because, you know, I don't know about you, but every time you go into a bodega or if you go into a grocery store in the last several weeks, when you see shelves empty, that's not a good feeling, and that's not something good to see, right? People are making deliveries, without whom, it's just to seniors and homebound elders, without whom our society just wouldn't function. We just wouldn't be able to survive. So this has really magnified who is essential, whose work we should really value, and bring up to speed in terms of resources. But the reopening of Queens and the city of New York is a very delicate one.
Yeah.
Very, very delicate, because it will cost lives if we do it carelessly, recklessly, too soon. And it's not just about lives, it's about which lives. And New York, we don't accept that any lives are expendable. But as we've seen in this pandemic, a lot of lives are disproportionately impacted. The cost of the inequities are disproportionately felt and suffered by certain communities, not because of the virus, but because of our underlying conditions.
What is happening in the borough's office in terms of getting that economic stability back in order? And what is your focus in terms of that?
It's been multifold. For one example, we've been doing periodic job fairs or virtual job recruitment fairs. We held 2 already, and the next one will be June 3rd. And I will tell you, Ms. Lamba, the first one on April 22nd, we had an RSVP count of a little over 600. And then the last one, which was last Wednesday, an RSVP count of over 900. Just within a span of 3 weeks. And so that could be by virtue of more people knowing about the job fair, but I think it's more a reflection of the need and where we are. You know, the pandemic has been devastating the workforce and the economy, and it's unsustainable. But again, we have to be very delicate about how we reopen. And so it's a really tricky situation, and it's a moving target, and it's inconvenient for many, but I'd rather have an inconvenience than life or death. So job fair, a couple of job fairs is one of them. We've had to be a little creative. One thing that we launched back in March, and it's still in the last tail end of it, of the initiative, it's called Fuel the Frontline. And the thought was we raise funds, and the monies go towards small businesses here in Queens. We're known for our restaurants, we're known for our entrepreneurs. And what's the best way to help businesses? Give them work. So we were fueling funds raised to local businesses, entrepreneurs. They in turn would create individually packaged meals to the tune of hundreds a day. And then those would actually be delivered same day, freshly made, amazing food, by the way. And those would be delivered to the front lines. So across 9 hospitals here in Queens. We have 9 across all 9 hospitals, some of the EMS stations, some of the bus depots. So that's been going on for several weeks. We were able to raise a little over $88,000 in the first month. Wow. And it's been sustaining. And all of those monies went directly to local businesses. And so it was a double whammy, right? We're fueling the small businesses. And we're not going to save the small businesses with $88,000, but it's a matter of keeping them afloat, helping them as long as we can, as this tide comes.
In New Jersey, Governor Phil Murphy today said that the state has a multi-stage roadmap for getting back on track, and more restrictions will relax as health indicators and states' ability to safeguard public health improves and continue to practice social distancing and face coverings. Helping in COVID-19 measures now, the Indian Business Association of New Jersey and Accurate Diagnostics open a COVID-19 drive-through testing site in Edison, New Jersey. You may register on iba@labscovidtest.com. The event saw Mayor Tom Lenke and many assemblymen and members of the council along with Indian American leaders. This testing site hopes to be a benefit for the overall tracking and progress of COVID-19 cases, ensuring all needing tests in the area have access.
That's it. Okay. Oh, sorry. You have to take it out the top one.
Take out the top?
Okay. Put in the garbage, that heat, and take the blue one. Yes. And just, yeah.
Let it up?
Yeah. Tight it. Make it tight.
A little bit more. Round and round.
It's just done. Just stick it.
Little bit more tight. Little bit more tight.
Little bit more. More.
Tight, tight.
It's okay. It's okay. Leave it.
Yes. I think it's done.
Okay. Give it to me. That garbage also. Thank you. You all set.
All set? It's very convenient. Staff's good. The appointment process was really easy. And I think everyone needs to get tested. You don't know what you're taking home to your kids. You don't know what you're taking home to your friends. So I think it's really critical for everybody to get tested, especially as the state gets ready to go back to work. Things are opening up. Businesses are opening up. Safer. Play it safe.
Guys, you can see the cars lined up on both sides. It's going to be the drive test. Nobody is going to get out of the car. It's going to be remaining in the car. People will have to just use the equipment and do the spitting to get the test done. And the result will be out pretty soon, within 24 to 48 hours. So you can see the medical staff here behind already started the process. You can see cars have lined up. Every day we'll be doing testing for hundreds of people. So this is pretty easy, fast, simple, one of the simplest COVID-19 tests available called saliva testing. IBA is organizing this in association with Accurate Diagnostic along with Agile Healthcare, along with all the sponsors.
Testing is a key to getting back to normal, and we're on our way there. And this site will be a great step in moving into that normal. And I applaud all the sponsors. You know, you can see everybody here, applaud everybody here, and especially IBA for setting this up and working for the community. They're always for the community, and this is another example of what they do for our community. So thank you for being here, and everybody be safe.
This is the diagnostics test, and it's very safe. It is a drive-through test. You don't come out of the car, so you know it's very simple. It takes like less than 5 minutes to do the test. Important thing about doing this test is, if you don't do the test, you don't know anything. If you do the test, then you have an infection. You just quarantine yourself for 14 days. Make sure you take all the precautions, and then everything is good. But if you don't do the test and you don't have symptoms, then what happens? You are infecting your family, friends, and everybody you meet. So this is very, very important that people do the test, and IBA is in forefront in doing this. This is in a very convenient location of Oak Tree Road, 2 minutes from inside the Oak Tree Road, and there is no cost for if you have insurance, and if you don't have insurance, still there is a way it can be covered.
This is the saliva test. You'll know your results within a day or 2 days. And it's so important, if you feel sick, if you are sick, please come. There's other places in the state of New Jersey and also in Edison, but this is local to Edison. Please come, be safe, and be well.
We want to thank Dr. Sudhir Parekh for covering the event. And I know you guys always come for every event of Indian community and all. And I want to request everyone that please do registration and do your testing, because at least you'll be safe from the person who has been tested. I have seen a store in New Jersey, they had 9 employees. And the store, it's written outside the poster that all the employees are tested negative. And believe me, the business of these people has gone up by 35% because of this, because people got a confidence that it is tested and it's a safe place to visit or buy anything. So I want to request everyone, please come out and do the registration.
It's time for another show break on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. This is Vision of Asia Coronavirus Special Report, and I am Aditi Lamba. Now we have highlights coming in from a virtual event organized by the Confederation of Indian Industry and the US-India Business Council, which held a discussion on India-US trade and investment partnership post-COVID-19 scenario. The event saw panelists on implications of COVID-19 on trade and investment opportunities and collaborations between India and the US, as well as ways to strengthen the relationship. Moderating the panel was Nisha Biswal and Chandrajit Banerjee, who discussed how businesses will survive this pandemic while also reflecting upon opportunities on manufacturing in India as well as technology. Here is the story.
As we started 2020, there was a lot of blue skies ahead of us as we looked to the visit of President Trump and as we looked to the prospect of a mini trade deal, and as we saw the U.S.-India economic partnership, really continue to scale up. We were at about 142 billion in two-way trade and investment. And we were seeing surges of FDI coming into India from the United States. In fact, India, I think, had become one of the top 2 or 3 destinations for American FDI in the world. Before Air Force One had really even cleared Indian airspace, the focus and attention turned dramatically. President Trump landed in the United States to mounting concerns about coronavirus and the prospect that it could come to the United States. India itself started seeing the impacts. And of course, economically, we felt the impact of the massive disruption to the supply chains that resulted from the shutdown of China for a period of almost 2 months. Now, 2 months after that visit of President Trump to India, we're encountering a dramatically different global scenario. The pandemic has ravaged the globe. There's not really a corner of the world that has not felt its impact. Of course, the United States has felt it more deeply than any other country, as you've seen the numbers in terms of the number of cases as well as the number of fatalities. And we're not out of the woods yet. And yet, at the same time, we've also seen that the impact of this virus is not just the health impact, it's also the dramatic and devastating economic impact that it has brought. Unemployment figures in the United States are approaching the Great Depression levels. So I think as we are grappling with the impact of this pandemic, we're also quickly starting to think about what does the world look like post-pandemic, and what does the global trading system and the economic system look like, and which industries are going to be able to maximize a return to normalcy or new normalcy, as they say, and how can we think about it?
Calibrated end to the lockdown, where more and more industries are opening up, and also with the government finally announcing, this packages, the details of which are just coming out. Even just an hour ago, I was hearing the finance minister talk about it. It all depends on, it's like to what extent it will provide the necessary liquidity to the system to get some kind of a, survival of the existing, sectors, especially the small and medium scale sectors on one hand. Also expectation of major reforms, which all the sectors are looking forward to, because this we see, even as the Prime Minister said, it is a crisis which, can offer an opportunity. All of us are looking forward to it. Only, the situation there is that, because several economies now, including the US for that matter, and also in terms of how people see it, they will turn inward looking, probably, come out with more protectionist kind of a policies.
India exports textiles to Bangladesh, which then get converted into garments and shipped out. So not only do we export textile, but even the tags that go onto those garments, the packaging goes from India in many cases. And it's literally the garmenting which is done in a country like Bangladesh, and they do it really well. Similarly, if you look at industries like furniture, which are very labor intensive, are largely becoming China dominated. Even if you go to hotels in India or apartment complexes coming up in India, whether it's in Pune, Bangalore, Hyderabad, Delhi, anywhere, I mean, they're pretty much fit out with furniture today that is all imported. So the way I look at manufacturing is I look at it in three buckets. You have items like cement, steel, which are the cornerstone of your economy. Those have to be local. Unless you have those industries, aluminum and so on and so forth, unless those are local and they are competitive, you cannot build secondary and tertiary industries based on them. The second is industries which have large consumption in India. Now, if that can range right from automobiles to technical items to medical equipment to, I mean, medical equipment is a bit of a misnomer. It's a more high tech industry, but even things like cell phones and electronics, I mean, all these today are largely imported. And even though we say that we are manufacturing cell phones in India, it's largely assembly, and all the real value, 70-80% of the value out of that is coming from abroad. And the third category of imports, I mean, manufacturing, are those items where India is really becoming a global source. So whether those are pharmaceutical exports or manufactured exports like what we do, machine tools, and other kinds of manufactured goods. I mean, I think if you look at the second and the third category, which is essential items which can be imports substituted by local manufacturing and building global scale by creating large clusters. I think that's the kind of approach that is needed, whether it is semiconductors, whether it is 5G equipment. I mean, there has to be some kind of government involvement in getting those industries to India and getting them kickstarted.
Every disruption is really an opportunity, and it's kind of given all of us an opportunity for several things. I mean, many of us on the panel, as well as globally, have been talking about the new normal. I think we're all getting adjusted to what the world will be like. And I think most of us agree that it will not be like what it used to be. Okay. And I think in many senses, I actually think it'll end up becoming much better. There are lots of things that we have all extracted out as efficiencies, even in the context of what we're doing today. So things that we never thought we could do remotely, many of us are actually doing remotely. And so when the world restarts, in a sense, in a post-COVID era, I actually think that it will be a real good combination of best of the pre and post scenarios. Many of us will have some return to our offices, but we will be thinking quite hard about whether we need physical infrastructure for various types of things. We would all look at the need for travel and try to make sure that it is done in a more efficient way. Conferencing of this kind, I think, will become more popular. So as a result, I actually believe that the role of technology infrastructure becomes more and more critical as we think about how to not just handle disruptive situations like this, but to leapfrog in that context to become leaders in the world stage.
Here are some comments now coming in from community as well as local health professionals from New Jersey. Let's take a look at what they all share with us on ITV Gold.
The need of the hour is to help people. We have to survive. We have to survive together. We can all pass through this. There is going to be a tremendous effort by the US government in healthcare sector, the pharma companies, likes of Johnson & Johnson, likes of Pfizer, Catalent. Many of those companies are really investing in their R&D space, and hopefully they'll come up with some vaccine that will solve half of the problem. And half of the problems can be resolved only by you and me, we all together, because we all are the community leaders here. We all are the people blessed by God who can help the community directly, indirectly, financially, food-wise, otherwise. So my urge to all the ITV Gold viewers, please step up, please do something. Even you cannot go out, you can still contribute by way of counseling people on the phone, making some donations to some organizations, reaching out to people at least on phone, on emails, on various social media, see what you can do, how you can help. Every one of us have to step up, rise to the occasion, contribute. मेरी सभी मेरे भारतवासियों से दरख्वास्त है, इस महामारी की समस्या जो है हम एक होकर, साथ होकर ही इसको हम लड़ सकते हैं. कोई भी अकेला, मैं अकेला, आप अकेले नहीं लड़ सकते.
We have given more than 10,000 masks, 10,000 sanitizers directly to the community, to the people, because a lot of people are donating to the hospitals and nursing homes and some big charitable institutions. But we realize that common people in the local area doesn't have the mask, doesn't have the sanitizers, some foods and all that. So we have already donated more than 10,000 masks and the sanitizers, hot food, some snacks, and also the therapeutic items like ginger, garlic, lemon to the people.
And this wraps up our show for the night. Remember to send us your suggestions and get your organizations and voices on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from a remote location in New York City. This is Vision of Asia. I am Aditi Lamba. Take care and be well.